Power 93.7 WBLK. I'm Yasmin Young inside the 2 to 6 takeover. We are committed to connecting you with the resources that you need to keep yourself and your family healthy and safe, especially during this coronavirus outbreak and the pandemic. One of the resources that I definitely want to connect you with is Dr. Timothy Murphy. He is with the University at Buffalo. He's the lead for the UB Community Health Equity Research Institute. Welcome, Dr. Murphy.
Thank you very much. It's a pleasure to be here.
One of the reasons that I wanted to connect with you is because we've been hearing all of these reports about the disparity in deaths due to COVID-19 for African Americans. And with you working on this even prior to, the coronavirus pandemic, I wanted to ask you, why is there this disparity?
Yes, an interesting and important question. I mean, I'll just say one thing, first of all, is that it took a while for states and so forth to actually accurately collect race data. So it took a little bit longer than we all would have liked to see to recognize this disparity. And in the grand scheme of things, this disparity was predictable and not surprising. So if you look at a list of the CDC guidelines, who experiences severe disease due to coronavirus infection, it includes people with underlying illnesses, including heart disease, asthma, diabetes, among the leading underlying illnesses that are important. Well, if we look at the health disparities and the illnesses that are present in greater proportion of people who live in disadvantaged neighborhoods and in among African Americans, it's the exact same list. In Buffalo, an African American with diabetes is 250% more likely to be admitted to the hospital with diabetes. People have 300%, African Americans have 300% higher incidence of chronic diseases. So these are the people who experience the severe infection when they get coronavirus. So that's really the fundamental reason why African Americans are so overrepresented, if you will, in the deaths and in the serious illness that we're seeing. So, and then really I'm sorry, go ahead.
Oh, no, finish, please.
So what's the reason for that? Well, the reason for that really is the social determinants of health, that our communities, particularly on the east side, experience living conditions and are born into conditions that really have nothing to do with healthcare, but healthcare delivery, but determine these health disparities. For example, high unemployment, underdeveloped neighborhoods, poor access to healthy food, poor access to public transportation, failing schools. All of these things really contribute very importantly to health outcomes. And so the fact that we know those conditions are prevalent and we know they're associated with health disparities, which existed before the coronavirus pandemic, those are the really underlying reasons, those upstream reasons, if you will, why we're seeing these kinds of numbers in the pandemic.
So how do we fix this in the short term and in the long term so that if there is another, hopefully knock on wood there's not, but if there is another pandemic, it's not the same results?
Yeah, very good question. So let me talk about the short term first. So in the short term, so what we need to do, I believe, is to bring the resources to the people who are most vulnerable. So if you think about it, because of those health disparities and because of the social determinants of health, our communities in Buffalo are vulnerable communities. So think about what we're doing in nursing homes. Nursing homes are vulnerable communities. In other words, more people who experience more underlying illnesses. Well, so are our selected zip codes in Buffalo. So that means we need to bring the resources to the community in order to remedy these things. So perhaps checking on people, making sure that they are able to as best they can to do social distancing, making sure that they have appropriate nutrition, reaching out to see if it is appropriate for them to contact healthcare providers. In other words, instead of a passive approach, waiting for people to come and ask for help, we, as a healthcare community and as a community, I think should invest in taking those active steps to reach out to identify folks who need who may need that extra help in order to address these issues that are resulting from the pandemic. So then one of the solutions to the long-term problems, though, those are tough solutions. And these are things that we've been talking about for a long time. Really, I've worked had the privilege of working with the African American Health Equity Task Force for the last 5 years, and this group put out a report about 6 years ago about the disparities in Buffalo, and have been investing in this. These are visionary community leaders: Pastor George Nicholas, Pastor Kinzer Pointer, Rita Hubbard Robinson, and others. And then we at the University of Buffalo have been partnering with this group to really focus on those social determinants of health. So with regard to what we can do, so from the point of view of let me talk about from what the University at Buffalo can do. So the university has invested in launching this institute whose mission is to perform research to understand the root causes of health disparities and develop innovative solutions. So if you think about those social determinants, we're not talking that much about healthcare. We're talking about neighborhoods and poverty and housing and so forth. So we have faculty, we are engaging faculty from all the schools of the university: the School of Architecture and Planning, the School of Public Health, the College of Arts and Sciences, the School of Law, the School of Management in terms of economics and so forth. And so I think that the solutions to the problem are multi-pronged, if you will. We need to focus on all of those social determinants of health and just persist and pick away, and each of these things do as much as we can and build on that. And that's easy to say, but very difficult to do.
Right. What are some of the available resources that folks can reach out to if they have any questions, if they think they may have been exposed, if they're symptomatic, anything that they might have a question about or need help with?
Sure. So in terms of information, I would recommend three websites. One is the CDC, cdc.gov, has the latest information and has lots of good information about a broad range of things related to coronavirus. The New York State Health Department similarly has New York State-related issues and so forth. And then the Erie County Health Department has a special page. All three of them have special coronavirus links when you go right to the website. If people are experiencing symptoms, in other times you'd say, well, you should go to your doctor. Well, that's not the best thing to do just yet. The first thing to do is to call your primary care provider. There's a lot of that can be done through telehealth. In other words, to protect you instead of going to a healthcare facility, so that you don't, if you don't have coronavirus, for example, you won't catch it. If people don't have their own healthcare providers, they can call an urgent care center or call the Erie County Department of Health coronavirus number that's been widely publicized. I'd also suggest that if, for example, if you have insurance, another approach is to call your insurance company, for example, Independent Health or Health Now locally, and then they can provide resources for you as well and advice for you as well if you are experiencing symptoms and you think you might have COVID.
I appreciate it. Dr. Murphy, thank you so much for this information, for all of these resources and your time. And thank you for everything that you're doing, to help fix these disparities in the short term and the long term. We appreciate it.
Well, it's a pleasure to be with you, and I thank you for what you're doing for the community in terms of communicating this important information.